Hello, my name is Hope Kelchner. Today is February 2nd of 2026, and I'm interviewing Mike Broody for my Studies in Compassion class at Mid-Michigan College. Before we begin, do I have your permission to record you for this project?
Yes.
Great. Thank you so much for taking the time out of your day to interview with me. Today, I have lots of questions to ask about your experiences with compassion. Before I do, I want to make sure we're on the same page with compassion's definition. Compassion is feeling someone's suffering and having the desire to alleviate it. With that being said, would you say that you grew up in a family with compassion for each other?
I would say so. Have an older brother, and me and him and my parents were very close growing up, so it was always a family knit community, and we would always do stuff for each other.
Okay. Were there specific traditions you had growing up?
Yeah, we had, in terms of food, two things come to mind. We had something called Try It Tuesday, which my mom came up with, and we would try a different food every Tuesday that none of us have ever had. And then most every Friday was pizza night, so we would all get pizza and just eat it.
Okay. This brings me to the concept of most people genuinely confusing kindness with compassion. You can do nice things for people, but it isn't until you know the other person's suffering to be able to step into their shoes and have desire to alleviate their pain. Out of your parents and your brother, who do you think shows the most compassion?
I would say probably my mom. She's always been, I'd say they're both very close to us, but my mom always seems to be more of the emotional type one. So if she saw that we were struggling or if we needed help with something, she would be very willing to step in. But my dad would as well. But I would say my mom would be more so.
Do you think the way your mom grew up allowed for her to have more compassion?
I would say so. She grew up with one sister and one brother, so one more sibling compared to me and my brother. So there's probably more friendly sibling competition. So I'm sure she brought some of that compassion from learning about her own family and brought that to us.
Okay. Growing up with Matthew as your only other sibling, do you think if you would have grown up with a sister that you would have more compassion?
I would say so. It probably just gives me a different aspect on personalities and traits and what other people like and what it's like to have another female in the family. So I would say it probably would have changed.
Okay. Can you think of a time in your life when compassion was shown to you to try and take away your own suffering?
Um, I'd probably say when I broke my foot playing hockey, and it was in the middle of hockey season and basketball season, and I was a very physical person, so it was tough for me to go to my games and be sitting there and watching everybody play, and I can't play. So that was the first time I ever broke a major bone and had to be sidelined for a while. So my entire family was very supportive and still taking me to the game since I couldn't drive and making sure I was there.
How did it make you feel to receive that compassion?
It made me feel good. It made me feel good in terms of I was still able to participate to some extent and supporting my team, and I was able to do that with the support of my family.
Okay. Do you think your family showing compassion towards you showed compassion towards themselves too?
Yeah, I would say so. It's the more you show for others, the more you can do for yourself as well. So just keep learning about what it's like to show the compassion for others, and that'll reflect on them, and then they can pass it on to other people, and it can just keep on going.
Would you say that becoming an EMT gave you more insight into being a compassionate emergency responder?
I would say so, yeah. Some of the calls that we get are very serious, and it's kind of up to me to be the calm in some sense, because the calmer the provider is, sometimes the calmer the patient, the calmer the family is going to be. So if I can just help put myself in their shoes, I can understand what they're going through. And sometimes we have the calls where it might not necessarily be an emergency to me, but it could be an emergency to that person. So I like to take that mindset into every patient that I have, that even though it doesn't seem major to me, it could be their worst day.
Okay. Do you have a specific scenario with a patient that made your compassion in the medical field grow?
Yeah, there's a couple, but if I had to pick one, I'd say we had a lady that came into the ER when I was doing my ER rotation at the hospital, and she was healthy the night before. The daughter came to visit her, and then the next morning the son came over, found her on the ground, unresponsive. They brought her in. She was very hypothermic. Her temperature, her core body temperature was about 88, and her heart rate kept dropping while her son was in the room. And unfortunately, she went into cardiac arrest while we were in there with her, and we had to just kind of get the son out of the room, kind of explain to him what was going on while we were treating his mom. Unfortunately, the outcome wasn't favorable. So that just kind of shows you how quickly things can take a turn. And when they do take a turn, you have to be there for the patient's families, especially in the healthcare setting. Whenever you're in the ER, things are unexpected and life happens.
Would you say that medical school influenced your perception of being compassionate, or do you feel like you already had a firm grasp of compassion going into school?
I feel like I already had a firm grasp on what I thought it was, but it definitely gives you a different perspective. I was used to being on the patient side of things. I didn't know what really happened in the background, but especially going into emergency medicine, it gives you the compassion to feel for your patients and their families when they're struggling, but also to keep that professional relationship where, especially in the ER, you can't get too close with your patient. You have to maintain that professionalism, because you could have a patient who you just worked on for 45 minutes doing CPR and they don't make it, and you need to go into the next room for a really young kid who is just born, or for somebody else who's really sick, and you have to start brand new and be compassionate with them as though something horrible just didn't happen. So it definitely gives you a different aspect.
Okay. Is compassion a subject that you learn specifically in medical school to have that desire to step into the patient suffering that you care for?
We go over some things. We had a couple classes that were devoted to how to approach certain situations. So, like death experiences, how to console the family and make sure that they understand what was going on. Or, if there's a kid that comes in and they're in cardiac arrest, it's how do you deal with that as a provider, with the patient, with yourself, and with the family. So we did have a couple classes that touched on that, but the majority of it comes from your clinical rotations. There's only so much you can learn from talking. You have to be in there during the cardiac arrest. You need to see what everybody's doing. You need to see how the family's reacting. We had one kid who came in, he hung himself, and I could hear the mom scream from the other end of the ER, and that is a voice I will never forget. It was the worst crying scream that you can imagine. So that is pretty burned in my memory.
Okay. What did you do to try and alleviate her suffering?
It's do the best you can in terms of talking to her, let her kind of be the lead. If she wants to come see her son, if it's however long she wants to spend too. If she wants to be alone, we can provide resources for her. Closed door, quiet. If you need food, water, chairs, bed, whatever you need, it's just whatever we can do to help with her pain and suffering, basically.
Okay. Being a medical student and rotating with the numerous doctors in their coordinating specialties, do you think that all doctors have compassion for their patients?
I would say they all do to some aspect, but definitely there are varying degrees per specialist. And it kind of correlates to what you're seeing. I would say the lower acuity, the professionals who see like the lower acuity stuff on a typical daily basis, they can form that relationship better than someone who sees the high acuity, sees a lot of patients per day, and constantly has to be up on their game. You can, if you're a family medicine doctor, you're making a connection with somebody in their family because you know they're going to keep coming back to you, so you can remember, oh, your daughter was trying out for the softball team last time you were here. That was 6 months ago. Did she make it? Like, you can remember that. But usually, and you become more compassionate with that patient, but usually in like the emergency setting, that might be the first and only time you see the patient. So you can only make so much of a compassionate relationship at that point. And you just do your best to, again, ties into what I said earlier, treat it as though this is their emergency. Even though it might not be a true emergency that needs dealt with right away, look at it from their perspective and try to connect on that level.
Okay. That leads me to the comparison of being sympathetic for a situation, which is feeling the pity or the sorrow for them. Have you had an experience with a patient where you felt like you need to have more compassion for their suffering rather than sympathy?
I would say so. And that kind of ties in what I said earlier about it being, again, I'll go back to emergency medicine because that's what I'm going into, and this ties into a lot of that. The what are described as lower acuity, so something that's been chronic going on for months, and people will come in at 3 or 4 o'clock in the morning whenever we are absolutely slammed with cardiac alerts, strokes, seizures, whatever it might be, traumas that are coming in, and I still have to go see this patient who's been having toe pain for 2 months and it hasn't changed. And tonight was their night that they decided to come in the ER at 3 o'clock while we're trying to deal with all of these other high acuity patients. You still, again, you want to take the time to make sure they feel like the priority at that point when you're seeing them. And that's true, they are. You have all of your other patients that are going on in the background, but you see them when you have time and when time allows. So I would definitely like to have more connection with them at that point, but it's hard when you have in the back of your head that you have 3 or 4 very unstable patients that you need to get back to, but you have to make this person feel like they are the center of attention for that time.
Okay. Do you have any weaknesses you feel need to be addressed regarding your compassion towards others?
I feel like there's always room for improvement. And I feel like every patient's going to bring something new, whether it's you hear more about the family, that their living conditions that they're coming from. Every patient's going to bring a different perspective. So I feel like you can always learn something from each patient, and you should keep building on it. So bring a different aspect in this patient, learn from this, and bring it into the next patient, and bring it into the next patient. So nothing specific that I can think of right now off the top of my head, but there is always going to be room for improvement.
Okay. Compassion does not feel good to step into the suffering of someone else to help them. Do you think there's an occurrence that makes others in the medical field genuinely not express as much compassion as they should?
Um, I would say, yeah, there could be, and again, it all ties back to what your specialty is and what your mindset is going in. Again, I'll go back to the ER again. It's going to be if you're absolutely slammed with a bunch of critical patients and you have somebody that comes in, you might be short with them. You don't want to be short with them, but you know that you have to get back to those critical patients. And while it's not critical to you at that point, it might be critical to the patient. So I have unfortunately seen times where the patient felt neglected, but they don't understand exactly what's going on in the background. And obviously you can't share that information with the patient because it's protected. You can't say that you have a cardiac arrest next door. You can't say you have a respiratory distress coming in 3 minutes. You can't say that you have a stroke that's following that respiratory distress in 5 minutes. You can't say that to a patient. So you just try to do your best. But unfortunately, I have seen and I have heard patients complain that the doctor was only in for 3 minutes and they never saw them again and they weren't happy.
Caregiver fatigue is a burnout that I'm sure you experienced through your time in medical school. How did you learn to pour compassion back into yourself after handling patients and their health problems all day?
Yeah. So it's finding time for yourself and doing what you like. I made a priority every week, every Friday after I'd be done with class or a rotation. I'd go and either take a drive to Lake Erie or just walk the beach and look for beach glass or go fishing if I got out early enough to help recharge. And I just take the days off and do what I feel I need to do so I can help get back to 100% for the following day that I go back in.
Okay. How did it make you feel to relieve your own suffering?
It's good. And it whenever you relieve your own, it gives you the appreciation for what others are going through and how they also have to relieve it. So I feel like that's an attribute that even people out of healthcare can really understand.
Did you rely on fellow med students in school to help you with your own self-compassion?
Sometimes it's nice having people who are also in the medical field to get insight on things, and that's also helpful for people outside the medical field to see how they feel as well. So I kind of get two aspects of what my personality might be, and hopefully they align with both of those people.
Okay. What tools did they use to help you fulfill your own compassion?
Just giving feedback as we go. If I would go see a patient with another med student, then we would talk about the patient after, and maybe if something didn't go well as we were talking to them, or if we had to deliver rough news, or maybe it was a procedure where we didn't maybe numb up the person enough and they got mad at us for causing them pain. We can just talk about it and see where things went wrong and try to make sure it doesn't happen again in the future.
Looking back on medical school, being in your fourth year now, what would you have done differently to serve you and others better, compassionately, if anything?
Um, it's tough just because I've had some experience with this prior to getting in med school, but just like I said before, taking every patient as a brand new patient, brand new learning opportunity. I did feel like I did that pretty well, but maybe not to the extent that I could because I would always have other things running through the back of my head, like exams, or if I had a lot of assignments due. We have an end of rotation exam, and sometimes I would have to work the day before. So I would say my mental game might not have been there as full as it could be the day before a very, very big exam if I had to work. So it's just, again, bringing your A game every single day and treating each patient like you would want to be treated yourself or like you would want your family member to be treated.
With your residency match coming up in March, how will you use compassion specifically in your specialty with the emergency department being such a fast-paced environment?
Yeah, like you said, it's very fast paced, and like I've mentioned before, I think the biggest thing is treating everybody like this is their worst day. The ER, unfortunately, is used a lot nowadays as a primary care type center because of insurance reasons, or maybe they can't find a PCP. So again, just because you don't think it's an emergency or needs seen right away, you don't know how they're feeling. You don't know where they're coming from. They could be coming from a very bad household and they just need to get out for a little bit. So you need to be understanding of every patient and take the time with them that you can, also while prioritizing what you're seeing in the ER. But like I've said before, take each patient as their own and give them the attention they deserve.
Okay, that was my last question. Do you have any questions for me or any other input that you would like to add?
No, I don't think so. I think you hit a lot of the good things about this.
Okay, well, thank you so much again for being a part of my interview. You are very admirable in your field of work, and your patients will be lucky to have a compassionate doctor as you are.
Thank you very much.